Have you ever felt a quiet, unspoken shift in your body, a subtle change in your desire or performance, and dismissed it as just part of getting old? What if I told you that some of the most profound keys to maintaining your vitality, your sexual health, and even your prostate health well into your golden years aren't found in a pill bottle, but in a deeply personal, often misunderstood act? This isn't about quick fixes or magic bullets. It's about empowering you with knowledge, with insights into your own physiology and psychology, that most men over 60 wish they'd known decades sooner concerning a topic often shrouded in silence: masturbation. I'm Dr. Benjamin Carter, a urologist dedicated to men's health for over 3 decades, helping men over 60 not just cope with aging, but truly rediscover their vitality, their confidence, and their profound connection to their own bodies. Today, we're tackling a subject that, for many, remains tucked away in the shadows of embarrassment or misunderstanding: the often underestimated role of self-pleasure in the holistic health of older men. My mission is to cut through the noise, dispel the myths, and provide clear, actionable advice so you can understand your body better and navigate this phase of life with profound confidence and satisfaction. I'm about to reveal 5 critical secrets about masturbation that most men over 60 completely overlook, yet they are absolutely vital for your prostate health, your emotional well-being, and your continued sexual function. You've been told that perhaps sexual activity naturally wanes with age, but I'll show you why that seemingly harmless belief could actually be sabotaging your well-being. And make sure you stay until the very end, because I'll uncover one specific, often ignored aspect of how you engage in this act that's silently, yet powerfully, undermining your benefits, a mistake almost every man makes without knowing. If you're ready to take charge of your health, reclaim your vitality, and age with strength, hit that subscribe button and tap the bell icon so you don't miss any of my doctor-backed advice. Your health is your most precious asset, and understanding your body is the first step to a healthier, more fulfilling life. Give this video a quick like if you believe understanding your body is the first step to a healthier life. As men mature, the intricate dance of hormones, vascular health, and neurological pathways undergoes subtle yet significant transformations. These physiological shifts can gradually lead to reduced blood flow, changes in nerve sensitivity, and fluctuations in hormonal levels, particularly testosterone. The impact isn't just physical. It often silently erodes self-esteem, diminishes the desire for intimacy, and creates a ripple effect of anxiety and frustration through daily life. The pervasive societal narrative that sex is primarily for younger men, or that older men's sexual needs are negligible or even inappropriate, can be incredibly damaging. This narrative tells men their experiences are abnormal, leading to isolation, shame, and a profound reluctance to seek help or even openly discuss their most personal concerns, even when their bodies are trying to tell them otherwise. This cultural silence exacerbates the problem, leaving men feeling alone in their struggles. Beyond the immediate physical discomfort or perceived decline, issues related to sexual function and satisfaction often trigger a cascade of mental and emotional challenges. Increased anxiety about performance, sleep disturbances due to unresolved tension, and a profound sense of loss that can deepen into depression, impacting a man's very sense of identity and purpose. This isn't merely about the mechanics of arousal. It's about the deeply embedded connection between male sexuality and self-worth, a connection often ignored by medical discourse and society at large. Let me share a story. I recall a patient, Michael, a vibrant man in his early 70s. For years, he'd experienced a gradual decline in his ability to achieve and maintain erections. His struggle wasn't just about his body. It was about the silent shame he felt, the growing distance in his marriage, not for lack of love, but lack of physical intimacy, and a creeping sense of powerlessness. He resigned himself to it, believing it was an inevitable part of aging, something to be endured in silence. We discovered his physiological changes were exacerbating his emotional state because of an unspoken societal pressure to always be strong and sexually capable, even as his body aged. He thought if he couldn't perform with a partner, his sexual life was over. He had completely overlooked the idea of self-pleasure as a valid, even beneficial, aspect of his ongoing sexual health. Michael's journey back to confidence began not with a prescription, but with a conversation about the natural, healthy role of masturbation in maintaining not just physical function, but also emotional equilibrium and a vital connection to his own sensuality. It was a revelation for him, transforming his understanding of his own aging body and his place in the world. Another patient, Arthur, a retired professor in his late 60s, came to me with complaints of frequent urination and a constant, uncomfortable pressure in his perineum. He was frustrated, losing sleep and feeling like his body was betraying him. His primary care doctor had mentioned his prostate was slightly enlarged, but the symptoms persisted despite initial treatments. In our conversation, it became clear Arthur rarely ejaculated, perhaps once every few months. He'd lived a life where sexual activity was something done with a partner, and since his wife passed away a few years prior, he'd simply stopped. He felt it was undignified or unnecessary to masturbate. This deeply ingrained societal perception that self-pleasure is for the young or for those without partners was silently contributing to his physical discomfort. His prostate, like any gland, benefits from regular flushing of its contents. Without it, fluid can stagnate, leading to congestion and irritation. Arthur's case beautifully illustrated how emotional and societal hang-ups directly manifested as physical symptoms. His journey involved not just medication, but a shift in perspective, embracing a healthy habit that supported his prostate. These are just two examples among countless men I've seen who navigate aging with a quiet desperation, believing that their sexual health, their emotional well-being, and their very sense of male identity must inevitably diminish. They often attribute these changes solely to age, overlooking profound, yet often unacknowledged, factors like the lack of consistent sexual expression, including self-pleasure. Our bodies, particularly our sexual organs, are designed for use. The use it or lose it principle, while often applied to muscles or cognitive function, is profoundly relevant to male sexual health, especially as we age. Now, let's dive into the 5 profound secrets older men wish they knew sooner about masturbation, and crucially, how they can embrace these insights for a healthier, more fulfilling life. Secret 1. Masturbation is a powerful ally for prostate health and urinary flow. This is perhaps one of the most overlooked and impactful benefits, especially for men over 60. The prostate gland, a small organ located just below the bladder, plays a crucial role in male reproduction by producing seminal fluid. As men age, it's common for the prostate to enlarge, a condition known as benign prostatic hyperplasia or BPH, which can lead to uncomfortable urinary symptoms like frequent urination, weak stream, and difficulty emptying the bladder. Beyond BPH, prostate health is a central concern for older men due to the risk of prostate cancer. Physiologically, regular ejaculation, whether through intercourse or masturbation, helps to flush out the prostate gland. Think of it like clearing a pipe. The prostate produces fluid, and if that fluid isn't regularly expelled, it can lead to congestion and inflammation. Research, including studies from the Harvard Health Letter and others, has indicated a potential link between higher ejaculation frequency and a reduced risk of prostate cancer. While the exact mechanisms are still being fully understood, theories suggest that regular ejaculation may prevent the buildup of carcinogens in the prostate, reduce inflammation, or even help in the regular turnover of prostate cells. Beyond cancer risk, regular ejaculation can alleviate symptoms of prostate congestion and contribute to better urinary flow. Many men experience a general discomfort or mild ache in the perineal area, often misattributed to other issues. Sometimes, this is simply due to a congested prostate that hasn't been adequately emptied. Consider David, a meticulous man in his late 60s who ran a successful accounting firm before retiring. He'd always prided himself on his health, but over the past few years, he'd started experiencing persistent discomfort around his perineum and a slow, hesitant urinary stream. He attributed it to just getting old and was reluctant to discuss it, even with his primary care physician. When he finally came to me, he was concerned about his prostate, fearing the worst. After ruling out more serious conditions, I introduced him to the concept of regular ejaculation for prostate health. David was initially surprised, almost embarrassed. He hadn't masturbated regularly since his youth, feeling it was an adolescent activity. We discussed the physiological benefits in detail, emphasizing it as a health practice, not just a sexual one. Within a few weeks of incorporating regular masturbation into his routine, David noticed a remarkable improvement. The discomfort lessened significantly, and his urinary stream became stronger and more consistent. He told me it felt like a weight had been lifted, both physically and psychologically. He realized he had been holding on to a belief that was actively hindering his health. David's story is a powerful testament to how a simple, often overlooked practice can bring tangible relief, and improve quality of life. Actionable solution for prostate health. To counteract prostate congestion and support urinary flow, consider integrating regular ejaculation into your routine. Aim for a frequency of 3-5 times per week, or whatever feels comfortable and sustainable for you. Here, how. 1. Establish a routine. Instead of viewing it as an impulsive act, consider it a part of your self-care. Perhaps set aside a specific time a few times a week when you have privacy and can relax. 2. Focus on relaxation. The act itself should be stress-free. Ensure you are in a comfortable environment. 3. Hydration. Drink plenty of water throughout the day. Good hydration supports overall urinary tract health and helps with the flushing process. 4. Listen to your body. Pay attention to how your body feels before and after ejaculation. Many men report a sense of relief and reduced discomfort. 5. Pelvic floor awareness. While not directly tied to ejaculation frequency, healthy pelvic floor muscles can support overall prostate and bladder function. Gentle pelvic floor exercises, sometimes called Kegels, can complement this by improving circulation to the area. To do this, simply contract the muscles you use to stop the flow of urine, hold for a few seconds, then relax. Repeat 10-15 times, 2-3 times a day. Secret 2. It's a powerful stress reliever and mood enhancer, especially in isolation. The emotional and mental well-being of older men is profoundly impacted by stress, anxiety, and sometimes loneliness. As life transitions occur, retirement, loss of a partner, changes in social circles, health concerns, these emotional burdens can become significant. Many men feel pressured to stoically endure these challenges, internalizing their feelings rather than seeking healthy outlets. This can lead to chronic stress, which has detrimental effects on nearly every system in the body, including cardiovascular health, immune function, and hormonal balance. Masturbation, often dismissed as purely a physical act, is a remarkable physiological and psychological stress reduction tool. During sexual arousal and orgasm, the brain releases a cocktail of neurochemicals, including endorphins, dopamine, oxytocin, and serotonin. Endorphins are natural painkillers and mood elevators, creating feelings of euphoria and well-being. Dopamine, associated with pleasure and reward, contributes to feelings of satisfaction and motivation. Oxytocin, often called the bonding hormone, promotes feelings of calm and contentment, reducing anxiety. Serotonin plays a key role in mood regulation, sleep, and appetite. For older men, especially those who may be single, widowed, or whose partners are no longer able to engage in sexual activity, masturbation provides a vital and accessible avenue for this neurochemical release. It's a safe, non-judgmental way to experience pleasure, alleviate tension, and simply feel good. It's a form of self-care that acknowledges and validates one's ongoing need for physical and emotional release, regardless of relationship status or age. Consider Robert, a retired school principal in his early 70s. His wife had passed away 5 years prior, and since then he'd become increasingly isolated. He was a proud man, active in his community, but privately he struggled with a pervasive sense of loneliness and mild depression. He found himself increasingly restless at night, often unable to sleep due to racing thoughts. Robert had always considered masturbation a young man's game, something he did in his youth but certainly not in his current life. He associated it with a sense of desperation or sadness if done in isolation. We discussed the powerful role of oxytocin and endorphins, explaining how these natural compounds could act as an antidote to his stress and loneliness. I encouraged him to view it as a legitimate form of self-soothing and a healthy physiological release. Initially hesitant, he later reported a significant improvement in his mood and sleep quality. He described it as a release valve for the day's anxieties and a way to reconnect with a sense of pleasure that he thought had been lost. Robert's experience underscores the profound impact of recognizing and legitimizing masturbation as a tool for emotional regulation and mental well-being, especially when external sources of intimacy may be limited. Actionable solution for stress and mood. To leverage masturbation as a tool for stress relief and mood enhancement. 1. Mindful approach. Approach it with intention. Instead of a quick, rushed act, try to be present. Focus on the sensations, the relaxation, and the release. This transforms it from a purely physical act into a meditative, self-soothing experience. 2. Create a relaxing environment. Dim the lights, put on some calming music, or ensure privacy. Treat it as a deliberate act of self-care. 3. Acknowledge your needs. It's okay to desire pleasure and release, regardless of your age or relationship status. Validate these feelings for yourself. 4. Before sleep. For men struggling with sleep, engaging in self-pleasure before bed can help release tension, quiet the mind, and promote the release of sleep-inducing neurochemicals, leading to more restful sleep. 5. Combine with other stress relievers. Integrate it into a broader stress management routine that might include meditation, light exercise, or hobbies. The synergistic effect can be powerful. Secret 3. Maintaining erectile function and penile health through regular stimulation. This is the use it or lose it principle in action, specific to the male anatomy. Many men over 60 experience changes in erectile function, ranging from less firm erections to difficulty achieving or maintaining them. This can be due to a variety of factors: cardiovascular disease, which impacts blood flow to the penis, diabetes, neurological conditions, hormonal imbalances, like low testosterone, certain medications, and psychological factors such as anxiety or depression. The societal pressure to maintain a certain level of sexual prowess, coupled with the silent decline of function, often leads to significant distress. Physiologically, the penis is a vascular organ. Erections rely on healthy blood flow into the penile tissue, causing it to engorge. Regular erections, whether nocturnal, occurring naturally during sleep, or stimulated, are crucial for maintaining the health of the penile tissues. When the erectile tissue, corpus cavernosum, is regularly engorged with blood, it helps to keep the tissue oxygenated, flexible, and healthy. Think of it like a muscle that needs exercise to maintain its strength and elasticity. Infrequent erections can lead to a phenomenon known as penile atrophy, where the smooth muscle tissue and elastic fibers within the penis lose their elasticity and even shrink, making future erections more difficult to achieve and less firm. Masturbation provides a safe and reliable way to induce erections and maintain this vital blood flow and tissue oxygenation. It allows a man to stimulate himself at his own pace, without performance pressure, and to understand what works for his body as it changes. It's a form of erectile rehabilitation that can be done privately and consistently. Consider Frank, a vigorous man in his early 60s, recently divorced after a long marriage. He was eager to re-enter the dating scene but found himself increasingly anxious about his erectile function. He'd noticed a decline in firmness and consistency over the past few years, which he attributed to stress from his divorce. He was worried about failing with a new partner. Frank had largely stopped any sexual activity during the later, difficult years of his marriage. When he came to me, he was considering aggressive treatments for his erectile dysfunction. While we discussed medical options, I also emphasized the importance of regular self-stimulation to rehabilitate the penile tissue. I explained how regular engorgement with blood helps keep the arteries and smooth muscle healthy and pliable. Frank, a practical man, embraced this advice. He started a routine of self-stimulation several times a week, focusing on sensation and achieving good erections without the pressure of performance. Over several months, he reported a noticeable improvement in his natural erections, feeling more confident and less anxious. He understood that he was actively working to maintain his penile health, not just waiting for problems to arise. This proactive approach, centered on regular self-stimulation, significantly improved his confidence and his physiological readiness for future intimacy. Actionable solution for erectile function and penile health. To maintain erectile function and promote penile tissue health. 1. Regular stimulation. Aim for consistent self-stimulation to achieve erections several times a week. The goal is to encourage regular blood flow into the penile chambers. This can be daily or every other day, depending on your comfort and desire. 2. Focus on firmness. Pay attention to achieving the firmest erection possible during these sessions. This maximizes the stretch and oxygenation of the penile tissues. 3. Varied stimulation. Don't stick to just one technique. Experiment with different pressures, speeds, and even positions to engage various nerve endings and vascular responses. 4. Use lubrication. As men age, natural lubrication may decrease. Using a water-based lubricant can enhance comfort and reduce friction, making the experience more pleasurable and less likely to cause irritation. 5. Address underlying health issues. Remember, masturbation supports, but does not replace, addressing underlying health conditions like diabetes, heart disease, or hormonal imbalances that can affect erectile function. Consult your doctor for a comprehensive health assessment. Secret 4, it's a vital tool for self-discovery and body awareness, even in aging. Aging brings changes not just to our bodies, but to our perception of ourselves. For men, who are often conditioned to define themselves by strength, productivity, and sometimes sexual prowess, the natural shifts of aging can be disorienting. There can be a disconnect between the self they remember and the self they are becoming. This can lead to a diminished sense of body awareness, an avoidance of one's own changing physical landscape, and a reluctance to explore new forms of pleasure or sensation. Masturbation provides a unique and private opportunity for ongoing self-discovery and body awareness. It allows a man to explore his changing body, to understand what feels good now, how his sensitivity might have shifted, and what new forms of pleasure he might discover. It's a chance to recalibrate, to honor his current physical state, and to reconnect with his own sensual self without judgment or external pressure. This is particularly crucial for older men who may have spent decades focusing on their partner's pleasure, or who might have lost a partner and now need to redefine their own sexual landscape. It's an empowering act that says, "My body is still capable of pleasure, and I am worthy of experiencing it." Consider Thomas, a widower in his late 70s. His wife had been the center of his emotional and physical world for over 5 decades. After her passing, he felt utterly lost, not just emotionally, but also physically. He believed his sexual life was unequivocally over. He wouldn't even look at himself in the mirror below the waist, so strong was his sense of loss and perceived decline. When I gently suggested that exploring his own body through self-pleasure could be a way to reconnect with himself, not as a replacement for his wife, but as an act of self-love and presence, he was initially resistant. He saw it as a betrayal of his late wife, or simply futile. We talked about the concept of self-compassion and how recognizing his body's capacity for sensation and pleasure was a way to honor his own vitality, not his past. Slowly, Thomas began to experiment. He discovered that while his body responded differently than in his youth, it still responded. He found new areas of sensitivity, appreciated a slower, more mindful pace, and gradually regained a sense of connection to his physical self. This journey of self-discovery through masturbation helped him process his grief, rebuild his confidence, and ultimately feel more at peace with his aging body, enabling him to engage with life with a renewed sense of presence and self-worth. Actionable solution for self-discovery and body awareness. To use masturbation as a tool for self-discovery and body awareness. 1. Embrace exploration. Let go of expectations from your younger years. Your body has changed, and so might your preferences. Experiment with different types of touch, pressure, and areas of stimulation. 2. Mindful observation. Pay attention to subtle sensations. What feels good? What feels different? How does your body respond at various stages of arousal? This cultivates a deeper understanding of your current physiology. 3. No pressure to orgasm. The goal isn't always orgasm. Sometimes the journey of arousal, the sensation of touch, and the connection to your own body can be just as fulfilling. Focus on the process, not just the outcome. 4. Use your imagination. For some men, engaging fantasy or visual aids can enhance the experience and help in self-exploration. This is a personal journey, free from judgment. 5. Acknowledge changes with acceptance. If you notice changes in sensitivity or response, acknowledge them without judgment. This is a natural part of aging, and understanding these changes allows you to adapt and find new ways to experience pleasure. Secret 5. The how matters. Technique, frequency, and emotional context for optimal benefit. It's not just that you masturbate, but how you do it, how often, and with what emotional mindset that profoundly influences the benefits you derive. Many men fall into a habitual pattern, perhaps replicating techniques learned in adolescence or from media. However, as the body ages, what worked before may no longer be optimal, or may even be counterproductive to achieving the desired physical and emotional benefits. The societal silence around male sexuality, especially for older men, means there's rarely open discussion about optimizing these deeply personal practices. From a physiological perspective, different techniques can impact blood flow, nerve stimulation, and muscular engagement differently. For instance, too much aggressive friction can desensitize the penis over time, while a slower, more deliberate approach can enhance sensitivity and prolong pleasure. The frequency also plays a role in maintaining prostate health and erectile tissue oxygenation, as discussed earlier. Too infrequent and benefits are missed. Too frequent, and it could lead to desensitization or preoccupation. Emotionally, the context is vital. Is it a rushed, guilt-ridden act or a mindful, self-caring one? Is it a solitary relief or a way to stay connected to one's sexuality, even when partnered? The emotional context dictates whether it becomes a source of shame or a pathway to well-being. Consider Michael, a meticulous man in his early 70s. He'd always prided himself on his health, but over the past few years he'd started experiencing persistent discomfort around his perineum and a slow, hesitant urinary stream. He attributed it to just getting old and was reluctant to discuss it, even with his primary care physician. When he finally came to me, he was concerned about his prostate, fearing the worst. After ruling out more serious conditions, I introduced him to the concept of regular ejaculation for prostate health. Michael was initially surprised, almost embarrassed. He hadn't masturbated regularly since his youth, feeling it was an adolescent activity. We discussed the physiological benefits in detail, emphasizing it as a health practice, not just a sexual one. Within a few weeks of incorporating regular masturbation into his routine, Michael noticed a remarkable improvement. The discomfort lessened significantly, and his urinary stream became stronger and more consistent. He told me it felt like a weight had been lifted, both physically and psychologically. He realized he had been holding onto a belief that was actively hindering his health. Michael's story is a powerful testament to how a simple, often overlooked practice can bring tangible relief and improve quality of life. Actionable solution for optimal technique, frequency, and context. To optimize your masturbation practice for holistic health. 1. Vary your technique. Avoid repetitive, intense friction, which can lead to desensitization. Experiment with different grips, pressures, and speeds. Try incorporating lubricant generously to reduce friction and enhance sensation. Explore techniques that mimic intercourse or those that focus purely on light touch and sensual exploration. 2. Optimal frequency. While there's no magic number, 3-5 times a week is often cited in studies for prostate health benefits. However, listen to your own body and libido. The right frequency is what feels beneficial and sustainable for you, avoiding any sense of compulsion or obsession. 3. Mindful engagement. Approach self-pleasure with intention and presence. Focus on the sensations, the relaxation, and the release. This transforms it from a purely physical act into a meditative, self-soothing experience that enhances emotional well-being. 4. Incorporate sensory aids. Use a warm bath or shower, scented oils, music, or visual aids to enhance the experience and make it more pleasurable and relaxing. 5. Emotional context. Release any shame or guilt associated with masturbation. Frame it as a legitimate form of self-care, a way to maintain physical function, manage stress, and explore your own evolving sexuality. It's a healthy, natural human behavior regardless of age. If you are partnered, communicate openly about your needs and practices, as self-pleasure can enhance overall intimacy by reducing performance pressure and increasing self-awareness. Emphasis on benefits of positive change and empowerment. With just a few minutes of consistent effort and a significant shift in mindset each day, many of my patients report noticeable improvements in erectile firmness, bladder control, and a profound reduction in stress and anxiety within a matter of weeks. This isn't just about physical changes. It's about reclaiming a sense of freedom, vitality, and control over your own body that you might have thought was lost to time. Imagine being able to sleep through the night without interruption, feeling lighter, more at ease, or engaging in intimate moments with newfound confidence and a deeper understanding of your own body's unique pleasure points. That's the transformative power of a strong body-mind connection, and it's entirely within your reach, regardless of age. This journey isn't just about reversing symptoms. It's about rediscovering your body's inherent strength, rekindling your vitality, and restoring a deep sense of self-worth that empowers you in every aspect of your life. You're not merely managing a condition. You're actively building a stronger, healthier, more fulfilling future for yourself. The changes you make today will ripple into every tomorrow, bringing greater joy, peace of mind, and a profound sense of self-respect. This is about taking control, owning your health, and understanding that you deserve to feel good, to experience pleasure, and to live vibrantly, no matter your age. Bonus tip: final intriguing reveal. But there's one more surprising, yet incredibly common habit that quietly affects your sexual health: your energy levels, and even your prostate while you go about your day, often without even realizing it. It's something most men never even consider, and yet it might be the very reason you're experiencing subtle discomfort or a lack of full satisfaction. This hidden mistake is the often overlooked impact of inappropriate clothing and prolonged sitting on your pelvic floor and overall circulation, particularly for older men. Think about it. Many men, especially as they age, adopt habits of wearing restrictive underwear like tight briefs, or spend long hours sitting, whether at a desk, watching television, or driving. While seemingly innocuous, these habits can create a microenvironment that subtly compromises your health. Tight underwear can restrict blood flow to the groin area, reduce testicular temperature regulation, which is vital for sperm health, even in older age and overall testicular health, and put undue pressure on the perineum. Prolonged sitting, on the other hand, can lead to chronic compression of the pelvic floor muscles, reduced circulation to the prostate and penis, and even contribute to pelvic floor dysfunction. This can manifest as anything from a dull ache in the perineum to a feeling of congestion in the prostate, or even contribute to subtle erectile issues due to compromised blood flow and nerve function over time. It's a silent assailant that many men unknowingly invite into their daily lives. Here's the powerful, actionable insight. You can significantly enhance the benefits of regular masturbation and overall male health by simply adopting more supportive clothing choices and integrating movement breaks into your daily routine. Shifting from tight briefs to looser-fitting boxer briefs or boxers allows for better air circulation and reduces compression. More importantly, consciously breaking up long periods of sitting by standing, stretching, or walking for even a few minutes every hour can dramatically improve pelvic blood flow, reduce pressure on the prostate, and keep your pelvic floor muscles more pliable and healthy. This simple habit, often dismissed as trivial, directly supports the vascular and neurological health that underpins strong erectile function and a healthy prostate, making your self-pleasure practices even more effective and your overall well-being more robust. It's about optimizing your environment for optimal health, not just your direct actions. This small, consistent change can lead to a surprisingly significant improvement in your comfort, your function, and your overall sense of vitality. Stronger call to action and interaction. If this video helped you understand your body better, empowered you with new strategies for health, and opened your eyes to these vital, often unspoken truths, please share it with another man who desperately needs to hear this message. Let's break the silence surrounding men's health together. Your health journey is a shared one, and by engaging, you empower not just yourself, but countless others who might be struggling in silence. Don't forget to subscribe to my channel, because I'll be sharing more doctor-backed advice made especially for men like you, helping you navigate every stage of life with confidence and profound well-being. Leave a comment below and let me know which of these 5 insights resonated most with you, or if you have a question. I read every comment, and I'm here to listen and support you every step of the way. You've taken the first crucial step towards reclaiming your vitality and confidence. Now, keep going. Your best years are still ahead, and you absolutely deserve every one of them to be full of health, strength, and profound satisfaction.